Hi guys, so today our patient is an 85-year-old female. She presented with COPD exacerbation to the emergency room with shortness of breath and a weak cough. Her initial assessment reveals 2+ pitting edema in the lower extremities. She has crackles in her upper lobes bilaterally and diminished breath sounds in her lower lobes bilaterally. Her most recent vitals were 105/62 blood pressure, heart rate of 62, respiratory rate of 22, temperature of 100.4, and oxygen saturation of 89%. She is on a nasal cannula at 6 liters. She has a right IJ central line with a pulmonary artery catheter and a right 20 gauge in her AC. And she weighs 90 kilograms.
Hi, Ms. Walker. My name is Braden. I'm going to be your nurse today. Could you tell me your name and date of birth?
What, Mom?
Oh, I'm your nurse today. Could you tell me your name and date of birth?
I'm Sally Walker.
Yes. Could you tell me your date of birth?
My date of birth's 1935.
Okay. Do you know if you have any allergies?
I think I'm lactose intolerant.
Okay.
I don't think she has any allergies. She's a little
Don't be bringing me any milk.
Do you know where you're at today?
I don't know where I'm at.
You're in the
Like,
hospital.
I know I've got tubes all up in me though. I don't know how they got there.
Okay. Do you know what year it is?
It's probably like 2035 or something. I don't know.
It's 2020. The year's 2020, okay?
You okay, sis?
I need them to help me.
Are you in any pain right now?
Just when I cough, it
Just when you
hurts.
cough, it hurts?
I have trouble breathing.
If you could rate that pain on a scale of 1 to 10. 1 being least pain, 10 being most pain you've ever felt.
Probably just like a 3 maybe.
A 3. Okay. All right. Well, I'm gonna get started and go ahead and listen to your lungs if that's okay.
That's okay.
Okay.
Sis, did you tell him I can't have milk?
She can't have milk.
Okay, sorry.
Oh, you're good.
Hey guys, how's your patient?
Well, upon physical assessment, she has 4+ pitting edema in her lower extremities. She has a horrible cough. Upon auscultation, she has crackles in her upper lobes bilaterally. She still has diminished breath sounds in her lower lobes bilaterally. Her urine output was only 20 milliliters. Her blood pressure is 88/48, and there's a map of 61. Her heart rate is 54. Her respirations were 28, and her temperature went up to 101, and her O2 is at 85%. Her PCWP pressure is at 19. Her PAP is 35/20. She has yellow tinged sputum. She's on a simple mask at 15 liters, and she is at 95 kilograms.
All right, so do we have our labs back yet?
Let me see. Yes, her CMP showed that her potassium was 4.0. Her sodium is 120. Her BUN is 16. Creatinine 1. CBC showed her white blood cells were 30 and her BNP was 200.
Goodness. So what are we doing to replace her sodium? Because that could definitely contribute to her confusion.
Currently she's on 0.9% normal saline, and my suggestion is swapping it to 0.45% normal saline due to her pitting edema and her crackles.
Awesome. So why don't we get the doctor paged and we can get some new orders and go from there.
Okay, I'll go.
Dr. Griffin, please come to room 101.
Hi guys.
Hey.
It's being paged. What's going on?
So we just got a new patient in 101. She has a history of COPD. She's 85 years old. She's got some edema and crackles to her lungs. Her sputum's yellow. It's over
we're hoping maybe to get a sputum culture, some other meds. She's having trouble breathing and having some pain with her coughing.
She has oxygen right now.
Yeah, so she was on her nasal cannula, that wasn't working well, so we upped her to an oxy mask.
Okay.
That's still not really cutting it though.
What kind of labs are we looking at right now?
So we had a CMP, her sodium was low,
Okay.
BUN and everything else looked fine. Then her CBC or white blood cell count is indicating infection is real high. And then her BNP is at 200, so
Okay, so we got some elevation there.
yes, for sure.
Okay, well, okay, so since that oxygen isn't working, let's do a CPAP instead. I think that might work better. Maybe like a bronchodilator, maybe like albuterol, maybe treatment 3 ml nebulizer.
Awesome.
Let's also do maybe a steroid solumedrol because she said she's had an exacerbation. Okay, so let's do that. Let's give 40 milligram IM. We'll do that. And then since she has low sodium, let's do 0.45 normal saline, and let's do that 50 mils per hour.
Awesome.
So that way we'll replace that, but like we don't want to fluid overload her, obviously.
Right.
Let's give her some Zosyn for that pneumonia. Let's do that 4.5 grams every 6 hours, if you guys could do that.
Okay.
And then let's get her lisinopril, 5 milligrams.
Awesome. Do you want to order any more labs or anything like that?
Yeah, let's get another chest X-ray on her, so that way we can get her looking at that pneumonia, so that way I can kind of see what I want to do with that Zosyn, and then give her that another CBC, CMP, and BNP. If we can do those again, maybe later this afternoon, that'd be nice. And then check her ABGs, her sputum culture, and we'll do an EKG and look at her heart right now. Also, I think I want to do some Lasix maybe. Let's do some 40 milligram IV push. We can do that twice daily to kind of see if that edema goes down.
Awesome.
Yeah, and then that dopamine drip, I think I kind of want to do that too.
Okay.
Let's do a dopamine drip at 3 micrograms per kilogram per minute, if possible, so we can kind of get those vitals back to where they need to be, because those do not look good at all.
So we'll get that all started and let you know how it goes.
Okay.
Thank you.
If you guys anything else, just let me know. Thank you.
You're awesome.
Hello, I'm with pharmacy. These are the meds for room 101, Sally Walker.
Thank you.
You're welcome. Alright, we've got a breathing treatment for you, okay? And then I'm also going to get you set up on the CPAP. Okay.
And I'm gonna start running some of your new medications.
Keep on breathing.
What medication is she getting?
She's getting Lasix, Solumetrol, 45% normal saline, dopamine, and Zosyn.
What's the Lasix gonna do to her?
The Lasix is gonna make her pee a lot, and it's gonna get all the fluid off her lungs.
Probably peeing all night.
That's okay, we got a catheter in, so you'll be all good.
You're gonna be fine, sister.
Thank you, ma'am.
Thank you.
Hello, Sally. I'm Ashley. I'm going to take an x-ray. Is that okay?
Might as well.
Let's do this thing. You ready?
What the hell are you doing?
1, 2,
Off the
3. All right, let me go get those results. Okay. Looks like we got right-sided hypertrophy in the doctor will be right back in, okay? Thank you.
Alright guys, so our nursing diagnosis are decreased cardiac output and impaired gas exchange. So what are some interventions we can implement with this patient to get her feeling better?
So what we want to do for the decreased cardiac output is apply scuds and elevate her head of the bed.
We'll also want to do a fluid restriction of 1,000 milliliters and daily weights.
And we can also rotate her every 2 hours.
Awesome guys, and we'll go ahead and also monitor her eyes and nose pretty strict just to make sure we're not fluid overloading. Thank you.